Hello and welcome. I'm very pleased to welcome you to this session, which explores the idea of humanitarianism at home. My name's Daniel McAvoy. I'm the chair of this session and a lecturer at Deakin University and affiliated with the Centre for Humanitarian Leadership. So our contributions to this topic that we're calling humanitarianism at home draw on experiences in the Australian context, but we hope that they have a broader resonance with experiences elsewhere. Before commencing, I wish to acknowledge the traditional owners of the country on which I'm situated, the Wurundjeri people of the Kulin Nation, and I acknowledge all the diverse traditional owners of the lands on which this conference is held. I pay my respects to their elders, past, present, and emerging. And I'd particularly like to welcome any Aboriginal or Torres Strait Islander people who have joined us this afternoon. And I'd like to welcome, of course, everyone else and thank you for your interest in this session. My fellow speakers, Brendan, Brenda, and Annie, and myself will be exploring this idea of humanitarianism at home. And by this, I mean that we'll be discussing the relevance and the usefulness of the ideas and practices that we understand to be somehow a part of humanitarian action in Australian contexts. We'd like to take this moment to take the international out of international humanitarian action and to reclaim the term humanitarian to describe a range of activities that take place, not overseas, but within Australia. Yet which are nevertheless informed by humanitarian motivations, ideas, and ideals. So our speakers in this panel, Annie, Brendan, and Brenda, bring a diversity of perspectives, but we are conscious that there are many perspectives missing from this brief introduction to a topic, which encompasses everything from supporting refugee and asylum seekers, providing services and assistance to homeless people, working in disability or aged care settings, and working in disaster response and recovery, whether that be fire, floods, or extreme weather events. There are a number of reasons why we think it's worthwhile to focus on humanitarianism at home, or as some authors have preferred, domestic humanitarianism. In no particular order, this panel will seek to explore some of the following questions, and we'd also invite your questions and participation through the chat mechanisms on Delegate Connect. So the questions that we are considering part of our sort of general ambit here are why some roles are framed as humanitarian work when they're practiced overseas, but not framed in this way when they're practiced in Australia. We're also considering how aspiring humanitarians from Australia can best deploy their humanitarian values and skills within their own communities. We also ask how experienced humanitarian practitioners can apply their values, knowledge, and experience that they've gained overseas in Australian settings, and how humanitarian principles might inform more compassionate, effective, community-based emergency response in Australia. We also ask what lessons disaster preparedness work with communities in Australia has for humanitarian assistance, and to what extent humanitarianism is relevant to such work in Australia. And finally, but as a thread that I think goes through quite a bit of this work, or these questions, is we'd like to ask how the consideration of humanitarianism at home helps to illuminate the dominant assumptions, biases, and colonising practices of international humanitarianism. Before I provide a brief conceptual and historical overview, I'd like to introduce my co-panelists. Brenda Odiambo is from Kenya and is an advocate by profession and a member of the Law Society of Kenya. She has over 5 years of experience working in both the public and private sectors in Kenya, And her most recent employment there was with the Judicial Service Commission of Kenya as a judicial legal researcher for the High Court, before moving to Australia for further education. Brenda is also a professionally certified mediator and a member of the East African Mediation Training Institute. She's currently undertaking her Masters of Humanitarian Assistance at Deakin University. And alongside her studies, Brenda is a disability support worker with an Australian NGO, Life Without Barriers, an organisation that provides disability support services. And in her spare time, I'm not sure how she finds any, but in her spare time, she volunteers with the Asylum Seekers Resource Centre in the Human Rights Law program, which provides an opportunity to link her legal and humanitarian background. Superintendent Brendan Hurley is a manager, the manager of the Community Fire Unit program at Fire and Rescue New South Wales. He has over 20 years experience as a firefighter in Australia and also worked for World Vision as the regional disaster manager in the Pacific region. He's deployed overseas as a humanitarian operations manager in Solomon Islands, PNG, Timor-Leste, South Sudan, and Uganda. He's a graduate of the Master of Humanitarian Assistance and the Graduate Certificate of Humanitarian Leadership from Deakin University. And finally, to Annie. Annie Ingram is currently working with UN OCHA in Myanmar as an accountability to affected populations and community engagement specialist. Prior to this, she worked for the Australian Red Cross in Australia's Northern Territory, most recently as team leader for emergency services. She's also a graduate of the Master of Humanitarian Assistance, and she worked in Papua New Guinea and Indonesia, previously in communications and development. She's got degrees in media, international studies in the Indonesian language. So I thank my fellow panelists, and just before we start to hear from them, I'd like to just provide a little background to humanitarianism in the Australian context. In Australia, without any doubt, the practices of helping others, saving lives, preventing suffering, providing assistance to kin and to strangers, which we might now recognise as humanitarian, have been in place as long as humans have resided here, which is a very long time indeed, something like 65,000 or even 80,000 years of continuous culture. When the first Europeans arrived here, there were many occasions, shipwreck, drought, famine or fire, when their lives depended on assistance, food, water and shelter, which was provided to them through the compassion, humanity and knowledge of our First Nations people. Bruce Pascoe, in the book Dark Emu, provides some really evocative examples of this. Clearly, Aboriginal and Torres Strait Islander people have developed sophisticated mechanisms for dealing with disasters on country. And Annie will speak to some of her experience working alongside Aboriginal communities in the Northern Territory. I should mention at this point that we had planned and hoped that one of Annie's former colleagues would join us today from Darwin, but unfortunately she is currently in hospital. And our thoughts are with her, and we will miss the experience and the unique perspective that her contribution would have brought to this panel. Disasters we recognise have occurred in Australia since time immemorial. But the word humanitarian, this is something more recent. In a search of the online database at Australia's National Library, the first time I could find any reference to this word humanitarian was from the 1840s. Australian newspapers followed the lead of the British papers and often reprinted articles in full. And sometimes these referred to humanitarian actions or humanitarians. The term humanitarian appears to have been used at times with admiration, but just as often with some contempt. Humanitarians in the 1800s in Australia concerned themselves with a number of things. Some of the prominent themes that I noticed were following debates in the British press over how to respond to famine in Ireland, also with penal reform and campaigning to end the transportation of convicts from Britain to the Australian colonies. There's also some concern and protest at the unjust and inhumane treatment of Australia's Aboriginal people, and sometimes there was mention of efforts to provide them with charity. There were also quite active debates about campaigns to abolish the slave trade, and later to regulate or abolish the labour trade, or so-called legalised slavery, which saw some 60,000 Pacific Islanders transported to Australia to work in the agricultural sector, and in particular in the sugarcane industry in Queensland. Then, as now, individuals were motivated by high ideals, but they're often undone by poor practices. Then, as now, humanitarianism was sometimes deployed as a tactic of war, in this case on Australia's Aboriginal population. Those who survived this war were rounded up and placed under protection on Aboriginal mission stations, but in this process were often stripped of their culture, language and autonomy. Then, as now, there was an uncomfortable association between humanitarianism and white supremacy and privilege. My own family, on my father's side, were beneficiaries of the dispossession of traditional landowners, in the Innisfail region in far north Queensland. And relying on the labour of South Pacific Islanders, my great-grandfather and my grandfather settled on stolen land and established successful sugarcane farms. Distant relatives continue to farm the land north of the Johnson River today. Without the wealth from this, my father might never have attended university. Had he and my mother not attended university, I might not be here now with all the privileges that entails. But I digress. Several other scholars have made contributions and forays into the topic of domestic humanitarianism. Some of the notable ones are Lisa Malky, and 2015, and Tessa Altman, who used the term, and Lisa Malky explored the interplay between home life and deploying into the field for Finnish Red Cross workers, to try and understand their motivations. Some of Tessa Altman's research examines the motivations of those who work with asylum seekers in Australia and elsewhere. Lisa Ann Ritchie is another scholar, and introduces the term everyday humanitarianism, and has provided a useful overview of literature that examines how our everyday practices, from Facebook to fundraising, sponsoring children, all that kind of thing, and how these everyday practices intersect with an expanding notion of international humanitarian action. Recently, the Australian Red Cross has also begun to use the term everyday humanitarianism, and in a recent publication explore the actions and the outpouring of charitable giving that accompanied the Australian experience of devastating bushfires in the summer of 2019-2020. This is one of the few explicit examples of work that describes these Australian activities in an Australian context as humanitarian. Meanwhile, during the first year of the COVID-19 pandemic, it became clear that the basic need for services essential to maintain life with dignity within Australia were at an all-time high. And as cities locked down, it became clear that a humanitarian response was needed. This should not be surprising. As humanitarian practitioners, we recognise that there's a great fluidity between our international work and our work in Australia. While conventional ideas of international aid work assume that expatriate aid workers apply expertise developed within Australia to international disaster settings, we propose that the reverse is often the case. Humanitarian professionals returning to Australia often make contributions to emergencies in Australia that rely on the expertise they've developed in the humanitarian sector. Both Brendan and Annie will talk to this in some detail. At a moment in history when the humanitarian system is being interrogated to reveal structures that have supported and cultivated systematic racism, it's also revealing to ask why activities that are controversially considered humanitarian when they're conducted overseas are not described as humanitarian when they're practiced in Australia. By way of an example, Brenda will share her experience as an international student in Australia who's qualified as a disability support worker and who works in this role alongside her studies. It's interesting that if Annie had gone to Kenya to work in a disability and inclusion role as part of her humanitarian studies, it would be widely assumed that this work was a reflection of her humanitarian ideals. Why then do we not think of work in roles such as disability support or aged care support in Australia as humanitarian? And what does this say, if anything, about the assumptions and colonial tendencies that have animated the humanitarian system for the last 70 years? To explore this last puzzle in a little bit more detail, I'd now like to invite Brenda to speak and to share a little bit of her experience. And if there are questions, I'll try and drive the Delegate Connect question board. I think we'll probably have a little bit of time after Brenda's session, Annie's session, and Brendan's session for questions. And then we're hoping to have a sort of informal question and answer session and conversation towards the end. So thank you, and over to you, Brenda.
Thank you very much, Daniel, for the very, how can I call it, very detailed introduction. That was very good. Thank you. So as we have all heard, or as Daniel has introduced me, I'm Brenda. I'm Kenyan. I am a lawyer by profession and also a mediator. I came to Australia last year, the beginning of March last year. I just got in and the borders were closed after me. Happened to experience quite a culture shock, but yeah, thankful that I'm here right now. I came to Australia to pursue my master's in humanitarian assistance. Because having been a legal, in the legal profession and also in dispute resolution, I felt like I really needed to work with people more one-on-one or in depth to feel that I'm actually giving out or making a difference in someone's life, and just not sitting behind the desk and, you know, doing all the legal work most of the time. So the field that really resonated with me was either something like social work or humanitarian assistance. So doing my research, I fell in love with humanitarian assistance as a profession and picked it. So I came to Australia, and of course, somehow when you're in a foreign country, you have to raise bills, and you're looking for which profession can actually accept you as a foreign or international student, because not so many people would offer employment to like an international student. So Australia, and of course, I can just hear an echo. And you're looking for which profession can actually accept you as a foreign. Can you hear an echo after me? Because not so many people would offer employment to like an international. Australia. I'll hold on to the IT. I can just hear an echo. And you're looking for which profession can actually accept you as a. Is that better now? Is there any echo now? No. Yeah, so I'll continue. So coming here, sorry for the hitch anyway. Coming here, you interact with other people who are international students, of course, and you want to know how they find their way here, or how they are able to raise some income, at least to pay for your bills and stuff, and raise your tuition. So I was very surprised that very many international students are in the disability field, and aged care support. So it almost comes as an automatic that people will just tell you the best way to get employment is to do a Sat 4 in disability or aged care. So I did it, got my job and started working. So working in disability, I was very surprised because I felt like this is a field that kind of resonates with what my career path wanted to lead to. And I was asking myself, why again isn't this considered humanitarian work? Because looking at it with disability support work, what we do is you try to, excuse me, what we do is you try to help people that are living with disabilities, and this can be physical or mental, to lead the best life possible, just to make sure that they're having a quality of life that is almost equal to someone who does not have any form of disability, and they can access every other thing. So looking at it from that point and looking at humanitarianism, I connect it with the principle of humanity when it comes to humanitarianism. You need to value the life, or you need to have value of life when it comes to humanitarian work, and the same applies to disability support work. So just as Daniel has asked before, we were wondering, why isn't this considered humanitarian work when we are here? Now that my question would, as I'm speaking, the question that rings in my mind is, since there are so many people, so many international, let me call them immigrants or international students, or just people who are foreign that have actually come here that are in the field, are doing this form of work, why isn't it then considered like humanitarian work, or why hasn't it been considered part of humanitarian activities or something of the sort? We were left wondering, is it because maybe Australia does not consider this as something that would qualify to be classified humanitarian in nature? Or is it because Australia, because we're talking about Australia specifically, is it because Australia feels like it doesn't have any humanitarian need? Is it because it's a first world country and it's self-sufficient that it doesn't require humanitarian needs? Then I'm also left wondering, with now the world as it is going, COVID and everything is just trying to be localized. For people who've studied here, for Australians who've studied here, who've acquired experience here in the humanitarian field, my assumption is everyone who is kind of in the humanitarian field almost wants to be deployed to a third world country or a poor nation, as they might call it. But now everything be localized, that might not be happening again. So someone who has stayed here, lived here, grown up here, and is in the humanitarian field, how do they apply the humanitarian experience or knowledge within the country? Does it call for people to start reflecting on on the limits of humanitarianism? Like, we just should not be thinking of humanitarian work being just disaster related, conflict management, or epidemics or something, but also on our day-to-day living, what can we classify humanitarian work? And someone like me working there, do I qualify for humanitarian experience within the field, within the country? So those are the few questions that I had myself, and the few challenges that I experienced within my field. I feel like they're very much connected, but I also feel like they're kind of disconnected from the definition of just what humanitarian work is. So maybe we can take on questions later on, or just have a full-on discussion on, maybe how to go about this, and how it can be recommended further, maybe later on. So back to you, Daniel.
Okay, great. Brenda, thank you. And yeah, I think it'd be worth just pausing for a moment to see if there are any questions. And if I think because Brendan and Annie's presentations take us in a different direction, it'd be quite nice to just sort of interrogate this a little bit further before we move on. To start the ball rolling, I've got one question for you, Brenda. And I'm wondering myself to what extent reframing work in sort of the disability support area, or by, I guess, extrapolation in the aged care sector, or various other roles which exist in the Australian context. If we reframe them as humanitarian work, does it have any impact on the way that that work would be done, or the motivation that people would do that work? Do you think people would feel kind of better about some of the menial tasks and difficult tasks that you have to do as part of that work if it was more explicitly kind of considered to be humanitarian?
I think it would, that is a very good question, come to think of it. I think it would really make a big difference, in the sense that human beings somehow just love title, or doing something that is seen as having more importance. And I think if it was given that kind of title or importance, just by the change of name or change of description, there would be very high motivation. I think you'd see people running towards that field, and it would be respected more. Because up to now, I think there are people who look at disability support work as menial job, or something of the sort, yeah. But having been in the profession, I find satisfaction out of this more than I did practicing law. The change that you see with the impact you have in the lives of these people who actually need you, because they need you to help them live the quality of life that is the best for them. They're just, all of them are just trying to exist the best way possible. So you change the life of people every single day. You impact them every single day. You make the quality of their life better every single day. To me, I don't see any further satisfaction that human beings should be looking at. Yeah. It's similar to almost being a nurse. It's a respected profession. It's almost the same thing. It's almost the same thing, because when it comes to administering medication, you still administer medication, you still take care of it. You're almost like a physiotherapist doing, helping them. Like, there's a lot of things right there together. You give them, emotional support, physical support, all of those things, all in one. So why wouldn't they give this profession the same importance as humanitarian, as a humanitarian action, or profession would?
Yeah, I think that's a really good question and something that needs further further discussion. And it's quite funny. I'm thinking of the work that a lot of people who've worked as practitioners in humanitarian settings end up finding themselves doing work that is not, when you just look at the actual work itself, it's not that glamorous as it sounds. You know, working, setting up warehouses and, you know, checking inventories on trucks, you know, being covered in dust, building toilets for refugee camps or setting up pumps and water, you know, water bladders and things like that. None of this is particularly glamorous in itself, but we kind of, I think, almost bestowed glamour on these tasks by using this word humanitarian and by, or aid work. And it seems interesting that we don't have that. We don't do that for working so much in roles in Australian settings. All right, I can't see any questions. Just checking if the question function is working. Jess, if you're there, can you sort of post a question just to see that I am looking in the right place as a novice facilitator? All right, well, we might leave that for the time being, but we'll come back towards the end, Brenda, and there'll be the opportunity for people who've developed questions to ask questions at that sort of towards the end. So I'd now like to go off in an entirely different direction, and I'm going to ask Brendan to share his reflections working in the fire and rescue business. I've already introduced Brendan, so I won't give you further introduction, but yeah, if you'd like to go ahead and start, that'd be great. You are on, yep, you're on mute. Great.
Thanks, Daniel. And it's great to be involved in such a diverse conversation, and I'm really excited to be part of the panel with Brenda and Annie and yourself. So thank you very much for the opportunity to talk with the audience today. And I suppose I am certainly coming at it from quite a different point of view, and there might be a few people online wondering why there's a white Anglo-Saxon male sitting there in uniform with rank and insignia on his shoulders, talking to us about humanitarianism, which probably flies in the face of a lot of our humanitarian principles that we've been discussing, and we certainly utilise, and I utilise in my actions as an aid worker, both here within Australia, and I have in the past at international level. So a little bit of what I'm going to talk about now is around from my personal experience of being involved in the humanitarian sector at an international level, and how I've then been able to develop that experience and really put it together with a lot of my learnings through theoretical learnings, through my academic experience as well, and then putting that together with my operational experience and coming up with some sort of direction that I believe is fit for purpose, and certainly something that I think is beneficial to the communities that we serve within Australia, and particularly my area of operations, which is New South Wales, a state within Australia. As Daniel touched on, I've had a little bit of experience at an international level, both in a direct humanitarian programming setting, and I've also had quite a bit of experience in disaster response and recovery, particularly within the Pacific region. And then being able to couple that with my 20+ years experience as an emergency manager and operator within emergency management setting in Australia and New South Wales with the fire service. So when we particularly look at the fire service within Australia, we work under quite a command and control structure and environment, and it's quite a coordinated approach, predominantly focused on response. And what I've learned through my experience, that it's actually, if we're doing the other key sectors or aspects of emergency management, being prevention and preparedness and recovery, if we're doing that appropriately, there is actually no need to actually provide a response. But as we know, the term unprecedented has been quite widely shared over the number of years within Australia, being the 2019 and 2020 bushfire season. That's been reported on quite broadly and widely that we went through here in Australia. And then more recently being a number of flooding events, particularly within New South Wales, coupled with the COVID pandemic response and recovery. So we've actually seen a number of disaster events that have gone on top of each other and actually caused additional stress and pressure within the communities we serve within New South Wales. And why that's important is we're actually working with a lot of the volunteer-based and community-based organisations within New South Wales. We've actually seen our volunteer base become quite exhausted, which means that obviously our local communities have become exhausted and overwhelmed by the local disaster and events that we've been facing. But within my emergency management experience, I've taken on the approach of actually trying to introduce and utilise a number of my experiences from the international level at a local domestic level. And that is really around our accountability to affected communities and communicating effectively with those communities. And that is also around the humanitarian principles which we adhere to, being, you know, humanity, independence, impartiality and neutrality. A lot of the organisations within Australia, particularly within emergency management, being local medical services, ambulance services, police and fire, they all have their own particular values that their own specific organisation will adhere to. But for me, they don't particularly get to the heart of why we're trying to do what we do, and that's assisting the communities in which we serve. And that's to be better prepared for and to be able to prevent, respond to and recover from any disaster event that occurs. And within that, my experience, I've really tried to introduce a values and principle-driven approach to what we do within New South Wales and more broadly at the national level within Australia in emergency management operations. And when we tend to start to talk about that, it's really getting down to the nuts and bolts of how we communicate with our communities, how we serve the affected communities, and then provide some accountability. And in my experience, sometimes that is not widely accepted within the emergency management structures and particularly the agencies, because predominantly we are, a large contingent of those agencies are males, and one, we are also wearing uniform, which sends a particular message, let's say, at that level. So when we're talking about assisting and serving the communities in New South Wales and particularly within Australia, we're looking at building resilience through a community-based preparedness and education focus. And that's something that I've been discussing within my area of expertise, being the manager of a community fire unit program. I manage up close to 5,000 volunteers. So that's something that we've been trying to introduce and actually workshop with our volunteers around what that actually means at a local level on the ground. And introducing that real values and principle-driven approach to what our activities look like on the ground, but also taking into consideration key elements of a humanitarian response and recovery environment, being disaster risk reduction, and the ability within that disaster risk reduction to look at gender-sensitive disaster risk reduction and also disability inclusion. A lot of the contexts in which we operate within Australia and New South Wales aren't largely seen as humanitarian actual contexts, but we've started to see a shift within Australia, more recently within the bushfire response and recovery, that they're actually starting to get termed humanitarian crisis, which I struggle myself as an individual to compare that to, considering of my exposure and experience at an international level working in refugee camps in both South Sudan and Uganda. But you know, rightly or wrongly, the terminology and the context in which we operate are changing, and so does our terminology need to change. And that's something that I've, at my level, have been trying to introduce, that changing of terminology when we start to talk about preparedness and prevention, we actually start to term it as disaster risk reduction, or more broadly, community risk reduction, and what that means. I've also tried to have a focus on disability inclusion and the gender sensitive approach within that community risk reduction and the strategies related to that, and also taking on a cultural awareness and gender diversity approach. More recently, within the emergency management agencies within Australia, we've been starting to look at our disaster risk reduction and community activities, taking on a more of a protection approach around child protection, preventing sexual exploitation, abuse and harassment, what it means for disability inclusion and to utilise people with a disability, but also to have a focus on what that looks like when we're talking about disaster risk reduction activities and building that community resilience. And what we've been able to develop within Fire and Rescue New South Wales is actually an online awareness and training package for our, particularly my unit and my team being the 5,000 volunteers within my community fire unit program, is we're now being able to offer them some capacity building around those key sectors and elements that I was just talking around gender sensitivity, disability inclusion, core humanitarian standards, and a protection approach. When we have been able to advertise this and really promote it, I will say we've had a lot of, not so much pushback, but we've had a lot of questions raised to us saying, well, if we would like to take on a humanitarian programming approach, we should be going to work for a non-government organisation or private sector agency, or even go back overseas and work in a humanitarian setting. So it's not more broadly accepted, I would say, at this stage within particularly New South Wales, but we are starting to see a slow shift. We have had the emergence of a disaster recovery agency called Resilience New South Wales within the whole of government approach within New South Wales. And I really believe that will be where we'll start to see a cultural shift with their real focus on building community resilience. And we're taking on a more of a humanitarian programming approach, as I said, by the introduction and not just a cross-cutting theme, but really child protection, disability inclusion, and gender sensitive community risk reduction approaches within emergency management agencies within Australia. That shift will continue to be focused on, but I believe with the emergence of Resilience New South Wales, we will start to take on more of a humanitarian programming approach. And when we start to talk about and utilise that language, we're also been discussing within my team and more broadly in my organisation as Fire and Rescue New South Wales, as looking at our ability to play a larger role and more of a greater influence in that disaster risk reduction and preparedness stage. And we're looking at monitoring and evaluation frameworks. And when we first introduced those elements, other agencies, in particular other programs and people, were actually quite shocked to hear that we're actually utilising that terminology. But the partnership base that we've been able to develop within New South Wales to assist in that transition from emergency management agencies into longer term recovery agencies has been fantastic to date. And we've actually been congratulated on our ability to think outside the square and actually take on a broader humanitarian program approach, because as we know, the community needs particularly within Australia, are shifting and changing that quickly, that a lot of the emergency management and humanitarian based organisations are running and struggling to keep up with. So we're very open and willing to have that conversation. We are looking at our partnership approach and strategy to better utilise the skill sets that have been developed at the international level with non-government organisations and other community-based organisations, and a greater focus to be able to utilise them more at a local level within New South Wales and across Australia. So while we have a lot of lessons still to learn, we are looking at a change in the language we utilise, the terminology, taking on more of an accountability focus to the communities we serve, looking more broadly at a values and principle driven approach to our activities across emergency management agencies. And I always listen to the volunteers in which I assist in managing and supporting, and they quite often remind me to say that all these emergency management agencies and other various disaster recovery and welfare agencies need to pay attention more broadly to the communities in which we serve, because they're the ones that are trying to gain that attention. and the agencies need to pay more attention. So I think I'll leave it there, Daniel. I think I've spoken enough, but I do really encourage people to provide some questions through to Daniel, because I think the richness and the diverse conversations we can have across Brenda's experience, my experience at my level, and particularly Annie with her approach, I think there's a lot of questions to ask, and there's a great conversation to be had moving forward there. We've got a lot of areas in which we can improve and learn from at a local level within Australia. And I don't think we need to reinvent the wheel. I think we just need to open the conversation and utilise the skill sets we've got across the broad agencies.
Thanks, Brendan. That was an excellent overview. We have got a question for you. Questions coming from Jessica, saying, "Hi, Brendan. Have you had any pushback from the communities, affected populations themselves, to the terminology and cultural shift when responding to disasters?" So yeah, the communities themselves like kind of things being framed as humanitarian, or is that something that they don't particularly like? Great question.
Yeah, you're right, Daniel. That is a great question. From my experience, more recently, we had quite a large flooding event on the east coast within New South Wales, and the flooding event impacted a wide area. And when I was up there, I actually went out to a lot of the affected communities and was having some conversations with them. And initially, they were just really appreciative of the fact that they had some assistance within their local townships. But when we actually started to speak to them more broadly around what their needs were right now, and particularly what their needs may look like in a month's time, they really started to take on the lens of a humanitarian, not so much crisis, but it's certainly a humanitarian requirement, and to improve their ability to be able to recover from this disaster. I think we initially have had a little bit of pushback when we started engaging with the communities, particularly after the bushfire event in 2019, 2020, because there are a number of local communities that didn't want to be classed or termed to be part of a humanitarian crisis, so to speak. So I really think, to answer that question, when we communicate that change in terminology and language, we really need to clearly articulate and explain what that means. And it's actually, we're not classing a certain type of people or community. We're actually offering a more broader set of capabilities to assist the community to return to some sort of normality. You know, it's quite unheard of, well, in my time, in my experience within New South Wales and Australia, and just as an example I can provide, within the bushfire recovery element from 18 months ago, my agency was requested to provide a field hospital to one of the most populated regional country towns on a coastal stretch within New South Wales, because the local health services were that badly affected, and we had actually quite a large outbreak of disease in that area, health concern that actually affected quite the town, and the local health services couldn't cope with it. So quite quickly, the media got hold of that and jumped on board and started calling it a local or a greater humanitarian health crisis. We actually made a decision at an organisational level to actually not try and change their thinking around that, but actually try to come up with some key community messages that we could provide at the local level of what that actually means. So they weren't being classed as a particular, I'd say, not have their own ability to be able to help each other at a local level, but we needed to be quite careful in the terminology we used for the government at the end of the day, because they were trying to coordinate that response. So that's probably a long-winded way of answering that question, and I'm sorry about that, but we certainly have seen a shift in the terminology and the way it's described from the government down. I'm quite concerned and focused on what that means and how the local communities see that and how they accept that. And we have seen, I would say at this early stage, a little bit of pushback. So we need to improve our communication strategies with our local affected communities.
Great, thanks, Brendan. I'm now going to bounce to Annie, who's, I think, got some similar experiences to you, but from a different side of the fence with her experience in the Australian Red Cross. So yeah, looking forward to hearing about Annie's experience. And also, I think she's also going to share a fairly personal perspective of her sort of engagement in humanitarianism at home. So over to you, Annie.
Thank you. It's been really great listening to all of you. I almost forgot I had to present myself, so thank you for those perspectives. Yes, I have written something to read today. I don't usually like to read when I'm giving a presentation, so I'll try and read it in a non-boring way, but I've been wanting to write a bit more about some of these ideas for a while, and I thought that this might be a good impetus for that. Okay, for me, becoming a humanitarian at home was more by accident than by design. From a young age, somehow, I had known that I wanted to pursue a career in the humanitarian sector in what seemed to be this exciting international career path. By 22, I felt like I'd won the lottery getting to work in Papua New Guinea in the humanitarian sector. I spent much of my early and mid-20s working on international programs from here in Australia and abroad in PNG and Indonesia. But in 2016, my mum was dying of cancer, and it was time for me to stop frolicking about the Asia Pacific. This may seem like an awkwardly personal thing to share at a conference, but the more I've spoken to colleagues in the humanitarian sector since, the more I've realised that ageing, sick, or dying parents is an enormous consideration for anyone working away from home. So I came home, my mum died, and as the eldest of 5 children, with the youngest still in high school, my life shifted to what needed to be done at home. And unexpectedly, in the midst of personal crisis, I was examining my career, the business of helping, because now it was my family who needed help. To be clear, I'm absolutely not comparing my family's situation to the awful things that happen to people around the world. But I started to see the everyday way that people helped or tried to help through the lens of what I knew about helping in a professional, formal setting. I knew I was taking it too far when my teenage sibling wanted something and I drew her an M&E framework and stuck it to the fridge. It showed her the milestones she'd need to reach before she could get what she wanted and how I'd be evaluating her progress. I knew I wasn't going to be able to get back overseas for some time, and I needed to find something to channel my humanitarian energy into to spare my sister from M&E frameworks. So I threw myself into my studies at the Centre for Humanitarian Leadership. I kept learning Indonesian, and eventually I moved to the Northern Territory. When you're from South Australia and you've been living in Indonesia and Papua New Guinea, Darwin seems like the perfect compromise. For anyone not from Australia in this session, Adelaide is down the bottom and Darwin is up the top. Since living here, I've often thought of it as a home for lost souls of the Asia Pacific. For Australians in the humanitarian assistance and development sectors who are ready to come home, but not home. Most of my friends here in the NT I've met overseas. It kind of offers an expat life, but in Australia. It's tropical, laid back, and closer to fly to Asia than any other capital city in Australia. But the sadder reason there are so many of us in the Northern Territory is that there's a lot of work for us here. In my case, I found myself working at Australian Red Cross in emergency services. All of a sudden, most of the people I worked with were Aboriginal people. In Australia, Aboriginal people make up about 2.7% of the population overall. In the Northern Territory, it's more like 30%. That, alongside various other factors, including geography and the legacy of mission sites, mean many of our emergency responses in the Northern Territory are with Aboriginal communities. I've been living in the Territory for 3 years now, and I've been exposed to things to an extent I hadn't been previously in Australia. Racism, colonialism, inequity, disadvantage, and also my place in it. I was familiar with being challenged by these things in an international context, but this was Australia. It's not a country that lacks resources. We live in a democracy that is supposed to represent and provide for its citizens, to value human rights and equity. In fact, we often lecture other countries on it. Having the curtain pulled back on my own country has made me question a lot. The past year as a whole has also been a wild time to be in the humanitarian or emergency response sector in Australia as a whole. Both the Australian bushfires of 2019 to 20 and the COVID-19 pandemic have brought crisis to Australian soil at a scale we hadn't previously experienced. Everyone has been affected in some way. The bushfires in particular called many things into question for me. I watched my native Adelaide Hills burn on the news while I was deployed to Victoria. Passing through airports in my Red Cross garb, there were knowing smiles and nods from people in other emergency response uniforms and members of the public. People in airports applauded as Canadian firefighting teams got off planes, here to provide reinforcements or surge capacity. Foreign NGOs were arriving and local responders were reporting feeling displaced by them. Australia became a recipient of financial assistance from countries like Vanuatu and PNG. I was working in my home country, but I was seeing all of the issues I had encountered internationally. Australia was in need and the world was on our doorstep. I remember hearing an anecdote from an Australian working in Papua New Guinea. She was conducting training and someone came up to her in the break and said something along the lines of, "How can you be here telling us how to fix things? You should go home and fix your country's problem with its Aboriginal people." When I first started working in Papua New Guinea myself, my grandma, who was ever my biggest cheerleader, came to me concerned. She insisted that she was so proud of me and what I was doing and understood why. But her group of old lady friends had asked her, "Why is your granddaughter helping people overseas? Why isn't she helping the Aborigines?" And just note that that term is not generally used these days, but old people use it. My grandma wanted advice on how she should respond. At the time, all of my training and experience was focused on international assistance. There were people better qualified than me to help with the terrible inequality between Australians, I thought. But now that I've worked in that area, I wonder if it is still true. The humanitarian principle of humanity states that humanitarian suffering must be addressed wherever it is found. What if we find it right in front of us, at home? From my own experience of coming home and dealing with personal crisis, what stuck out to me the most was how much of the help offered wasn't very helpful at all. There were so many assumptions about what my siblings and I needed. We were told that the adults had discussed about us kids. I learned the way we help each other is so often guided by our own guilt or discomfort, rather than having the courage to sit in the suckiness of it all and work out what would make the people suffering the most feel better, rather than what would make us feel better. It's likely not a coincidence that in the years since, the focus of my work at a basic level has been about listening. I've found myself working on community-led disaster management, community engagement, and accountability to affected populations. Ironically, as I present to you today about humanitarianism at home or in Australia, I've recently started a new job with the UN in Myanmar. But there's also an irony in the fact that as I return to international work, due to a global pandemic and coup violence, I do that work from here in Darwin. With restrictions on global travel, many humanitarians have found themselves returning home. and questioning whether there is a need to be overseas to do humanitarian work, whether that work can be done remotely or whether that work exists in their own country. I have now spent most of the last 5 years in Australia. In a personal sense, I've dealt with crisis of a family nature. I've learned what it is to feel loss, and I've felt disenfranchised by those trying to help. In a professional sense, I've felt challenged by systems that don't put affected people at the centre. I've confronted some uncomfortable truths about Australia's history and its legacy today. And I've felt deep discomfort about the enduring inequality and racism that exists in our own country. As a result of this time at home, I hope I'm returning to international work with more humility, more empathy, and more humanity. Although, as I return to international work, albeit from Australia, I no longer view it as an either or. The boundaries between humanitarianism in Australia and humanitarianism abroad seem less rigid now, more blurred. I didn't necessarily choose to become a humanitarian at home, but having done so, I definitely recommend humanitarian workers to make that choice. I strongly believe it can give us the perspective to be better humanitarians. Thank you.